Good morning, everybody. Welcome. This is the Tuesday, April the 28th, Emergency Management Team COVID-19 update. You'll be hearing some staff reports this morning, along with administration and select board, and then we will open up to questions. I just want to remind, because again, we do have quite a lengthy agenda with questions and answers and department updates. There is a select board meeting this evening at 6 p.m. in the same format, where there are some agenda topics that will also be discussed tonight and some recommendations from our team. Chief Pauly, any opening comments?
No, not really. Thank you. Good morning, everyone.
All right, thanks, Chief. So our agenda, we'll go through with all of our department updates. We have 73 participants. So again, we appreciate the town's response to this, their enthusiasm, and of course our team who is here every week with our updates. So we'll begin this morning with the health department, and if we do have Out of Cape Health on the line, we'll chat with them after. So Hillary. Hillary, you're all set to go?
I have to unmute her, sorry. I muted everybody because I don't want people unmuting themselves, so let me just find her.
Okay, thanks. On my Hollywood squares, I see her down bottom left.
Yep.
There she is.
I'm trying to unmute her.
Hello?
Go ahead, Hillary. Yep.
Okay, great. I don't have too much to report today, but we do have some masks that are available. I'll have them available tomorrow. So if folks could send me an email, I have a couple requests in. I have picked up another shipment from the Medical Reserve Corps, and I'm also going today to the high school employees' house to pick up some children's masks. So I think I'll have about 14 children's masks and a host of adult masks. So if folks need them, please do send me an email at Hillary, HILLARY, .Lemos, LEMOS, at wellfleet-ma.gov. And I do see a couple of restaurant folks on here. So if your restaurant staff need masks, please do reach out. You are one of our top priorities to get those items too, prior to you opening up. Testing, we're still trying to get increased testing on the Cape. Obviously, there is a push for that. There are some new antibody tests that are out and available. So we are trying to increase testing. A lot of effort from the state this week was spent on long-term care facilities with funding and resources. We obviously don't have long-term care facilities in our community, but our neighboring communities do. So we're still waiting to hear guidance from the governor. I expect we'll hear that by week's end. So I know this is difficult for everybody, but we're all sort of in the same holding pattern here. Bathing beaches, we're going to begin our testing program of oceans and ponds earlier this year than we have in the past. So we will have all of our bathing beach facilities sampled by Memorial Day weekend. I think we're expecting our local residents with children and not with children to be using the ponds and beaches sooner. So we have bumped that up. We're still working with our restaurants to get their plans in place. We've received some good feedback back from them and are sharing information. We have our students from the state working on that as well. So we'll be putting together more guidance and getting that up on a social media site soon. Mosquitoes and ticks are still a problem, so I don't want us to lose sight of that while we're all thinking about COVID. More people are out in the woods, so please do prepare yourself for ticks. They are emerging, and mosquitoes, of course, will come sooner rather than later. Water testing, while the Barnstable County lab is not open, water samples can still be submitted for analysis. The Ace hardware store in Eastham is accepting them. The bottles can be picked up at Ace, or you could probably still use the bottles that we have, but the samples are going off to Envirotech, and they can be dropped off at Ace Hardware by 1 o'clock each day of the week. So only on the weekdays, not on the weekends. And then just a brief reminder, the symptoms of COVID. We seem to have added a few symptoms, so I'll just run through those quickly. We have the cough, the shortness of breath, fever, chills, repeated shaking with chills, which is a new symptom, muscle pain, headache, sore throat, and loss of taste or smell. So if you're experiencing any of those symptoms, please do reach out to your primary care doctor. If you don't have a primary care doctor, we can get you an avenue to speak to one as well. So please do reach out to me. And with that, I think I'll stop for now.
Great, thanks, Hillary. I appreciate it. Courtney, we have Pat Nadel that's here. If we could unmute her for a out of Cape Health update.
They can unmute themselves. I don't.
Oh.
Yeah.
Okay.
Hi, Pat.
Can you hear me? Hi there, everybody.
Morning.
Good morning. Thanks for inviting us to participate. I'll just give you an update. The health center remains open Monday through Friday. We do have afternoon testing each day there in Wellfleet, and on Saturday morning, mid-afternoon to mid-afternoon in Provincetown. We are probably testing about 5 to 7 people a day. Many negatives, but again, you know, we're treating everybody as though they're positive. If they have symptoms, the false negative rate is pretty high. We are going to be we're going to be working with the state to drive testing higher and doing some contact tracing with them. So just sort of we're staying tuned on that. There's a lot more questions right now than answers, so that should roll out in the next week or so. But it's clearly to identify more folks for testing, and then we're planning on opening more time for testing as a result. So we'll see how that goes. I'll take any questions if there's something particular that.
If you could either just raise your hand or in the chat box if anyone has any questions for Out of Cape Health.
So Michael DeVasto and Justina Carlson do. We'll take Mike first.
Hey, I was just wondering, you said the false negative tests, or rather, I was just wondering if you could sort of give a sort of range of what you think that is, or what that data is based on. I hadn't heard that.
Well, folks with symptoms, what they're saying now is the false negative rate can anywhere between 10 and 50%. So what we're seeing now is folks are moving into antibody testing. And so there's, we've started doing some antibody testing through our Quest labs, which has a pretty highly reliable result. Some of others are maybe just doing it for, you know, it's a cash business, but right now we're doing some of that for those folks who we thought had symptoms, and we are testing them again. So we're treating anyone who qualifies, and I think that whole list of symptoms is great. Anyone who arrives with those symptoms, even we're testing them and then considering them positives so that we continue to follow up with folks.
And is there different reliability with different testing? Are you guys having different types of tests, or is it all the same test that's being used?
No, the regular swab for the COVID-19 is a same test. The antibody tests are ranging, and now they've actually Quest has a fairly good test with that has fairly good reliable results that we're using now. So that's a work in progress.
Thank you.
From the labs.
Pat, we just have somebody asking in the chat to please explain false negative, and then we'll go back to the other list of people with their questions hands raised.
To explain false negatives?
Yeah.
Sure. That means that if you've got symptoms, and usually the provider that's talking with you and doing an assessment feels pretty sure that you qualify, obviously, for testing because of your symptomatology. What we're being told nationally, this is, and probably internationally, that the false negative rate's very high. So we continue to monitor our negative patients who become who their test results come back negative, and who still continue to have symptoms.
Okay, thank you. We'll go to Justina and then Kathleen, Helen, and then there's another chat question.
Courtney, I unmuted myself.
Yep, go ahead.
Okay, great. Hi, Pat. Thanks for all that. I know you said you're working with the state, so my question may not have an answer yet, but do you see us having enough tests and ICU beds for an increased population as we ramp up for the summer?
In the partnership with the state has reached out and partnered with Quest, who has committed to make sure we have enough testing supplies. And so far we've seen that. They replenish our testing supplies based on our use right now and have committed to expand testing supplies at all sites. So right now we're not worried about testing supplies. The hospital utilization, particularly here on the Cape, is low, which is great. I think, you know, everybody staying home and keeping socially distant is having the results it should have. So right now we're, you know, we're on a call each week with the Department of the Barnstable Department of Health, and they're reporting low hospital utilization, which is great. We don't think that'll drive it up. I think if we can get folks tested the goal is to get folks tested and quarantined who've been exposed and get them out of circulation so that they expose less people.
And do you feel that we can keep that excellent work up if the population, I know in Wellfleet, we can go up as many as 15 to 30,000 people.
We're anticipating it. The state has, the Department of Health has contracted with us for 10 tracers, a couple of nurses, some resource folks who can help folks get the resources they need when they're informed they've been in contact with a positive person, and then they need to be quarantined for 14 days and then get them to testing. So we do think we can accommodate for that.
And how about when someone needs hospitalization in the summer? I know that I've read we have a Bourne Field hospital, but you know, if someone comes in a condition where they need to be hospitalized, do you see us having enough capacity? We have plenty of utilization now, but do you see us able to accommodate that temporary summer influx we get?
Yeah, I actually think that there's a really good plan in place. You know, we have the hospital beds themselves. They're the field hospital that's been put up out at the base. And then there are another 300 subacute beds that if we move patients out of the hospital, they can rest there until they're well. So bringing that capacity online will double our current capacity.
Well, I heard the word plan, an excellent plan, so that's nice to hear, and I appreciate the update.
Yeah, they really have done a very thoughtful job in looking at what we needed and how to utilize the flow of patients so that the sickest ones stay at the hospital. Those who are in recovery mode will move to a subacute setting and recover there because they won't go home yet.
Well, what a wonderful update.
Pardon me?
What a wonderful update. Thank you.
You're very welcome.
Kathleen Bacon is next.
Good morning, Pat. I've just unmuted myself, Courtney.
Yep, you're good.
Pat, you've already said quite a bunch, and I don't want to be redundant and take up any more time because we do have a large agenda. But are you and healthcare officials across the Cape, do you have any thoughts about what is happening in Boston right now and whether that's going to migrate this way? Obviously, it looks like we're well prepared for it, but should we be planning that that's exactly what will happen, what we see in Boston right now, coming this direction?
You know, each region has been very different in what their experience has been. You know, here on the Cape, we've done a really good job in staying home, staying distant, doing all the things we should do, so that the infectious rate is very low, which is great. And you know, folks have been, you know, to remember that folks became positive several weeks ago. They've already recovered. So right. We're in a very different place than Boston is. We're far less dense. You know, the biggest concern is that what the state decides. You know, we have to listen to the governor, and he's been, again, very thoughtful and very cautious about opening and who moves around the state and who can go to different places. So I think that's what we're going to have to be very careful about what we watch.
Again, thank you, Pat.
You're welcome.
Okay, next we have Helen, and then I'll get back to the chat questions. You're
Am I
unmuted, Helen.
unmuted?
Yep.
Okay, so for Pat or Hillary, do I understand it correctly that you are not testing people who are asymptomatic, even if they think they may have been exposed? In other words, if somebody calls up and says, you know, I went to New York City, I haven't really had any of these symptoms, but I may be asymptomatic. Are these tests not available for such people?
Hillary, I think, went through the list of the symptoms, which would
Yeah.
really kind of kick you into gear. I think things are going to change over these next several weeks as you watch these testing sites open up. That will allow for greater testing without, you know, I don't have symptoms, but I think I've been exposed, or I was at the grocery store and someone coughed in line, things like that. So I think we're going to see things over the next few weeks that will change the limits to testing. As I said before, some of the things we're doing, that if someone is a positive, and, you know, folks, the towns have done a really good job doing contact tracing, it's really to get those contacts that didn't know they were in contact notified. They may or may not have symptoms, but they can then get them to testing and then quarantine them. So that's going to be the important part about learning what is in each community, but also to reduce down cross-contamination.
Thank you. So I gather that the answer straight up at the moment is no. If you're asymptomatic and you call in, you don't get a test. Okay. The second thing is, I heard early on that there was also an intestinal distress symptom, and Hillary didn't list that. And in other words, there were people who were having diarrhea and so forth when they did have COVID and COVID-19. And has that symptom been taken off the list? Is it now being considered to be perhaps a response to drugs and so forth that you're given? Why is that no longer on the symptom list?
Hillary, do you want to take that in terms of, I haven't seen that on the symptom list per se. I've seen some of the loss of, you know, we've all seen before they put it on the list, the loss of smell and taste, but not necessarily a GI distress.
Yeah, I haven't, I've heard of folks having the GI distress, but it has not appeared on the official symptom list from CDC or Mass DPH. So I think some folks do experience that, but a majority of them do not.
Thank you. And my other questions were answered earlier. Thank you.
Okay, thank you.
Okay, so some questions from the chat. The first one is, can anyone get a test who has one of those symptoms in the absence of fever? So do you need to have a fever to be tested? And I think we're hearing that.
Actually, it's more important to go through the total picture and not just the fever. In some cases, we have found that the initial fever level we actually brought down because some particularly the elderly, run very low temperatures. So we actually brought that down a bit. So I think it's really a matter of talking with a provider and going through your total picture rather than just look at temperature.
Okay, great.
I think it is really important, just to jump onto that folks do reach out to their medical provider if they are experiencing any of the symptoms. Let's not use this call as sort of a, gee, do I have COVID? Do I not have COVID? I think if you are experiencing any of the symptoms, please do reach out to your medical provider. And again, if you do not have a medical provider, reach out to me and I can put you in contact with someone. So I think it's important that we stay focused on that.
Thanks, Hillary. The next question is, can somebody get tested for antibody if they've had symptoms months ago and fine now, but tested negative for flu back then? And is the antibody test an FDA approved test?
Testings are approved. Again, I would echo Hillary's comment. This is talking to a provider, talking about your history over these last several weeks. And now we're moving into months, so it would be important for that to occur.
Okay, and is the Quest Diagnostics antibody test an FDA approved test?
Yes, it is, and it's become very reliable.
Okay, thank you. That answers all the other questions. So we can, one more question is, from a public health standpoint, it will have an impact to check temperature in public spaces, for instance, when schools reopen. Is that the case?
It may be something we'll see in the months to come in terms of temperature checks. You've saw some of the news, you know, in terms of the new innovative technology that actually senses heat. So I do think it'll be a component going forward. I wouldn't even try to make a guess on that one, but they're seeing some of that stuff already out there in other countries.
Okay, thank you. Helen, if you have something new, I'll take it, and then we need to move forward with this. I'm trying to unmute you, Helen, but okay, go ahead.
Yeah. Yeah. I'm sorry. I'm interrupting like this. I'm not going to ask this now. I'll ask it of Hillary out of the meeting. Thank you.
Okay, thanks. All right, Chief Early, we can move forward if there's nothing else.
Great, thanks, Courtney. Pat, thank you again for joining us this week. I think very useful information, and we appreciate all the good work from out of Cape Health, and stay safe.
Well, thank you for having us.
Thank you. Next on the agenda, Department of Public Works. And if I could just open up this morning and thank them. We've had Chris Parker, who has been helping us with our building. We are open 24/7. We do have staff in here around the clock. And we've been having Chris come in through Public Works. He is in all the required PPE gear, which is personal protective gear, and he has been keeping us safe. So I just want to send out a big thank you to the DPW. So you guys are on.
Okay, I assume you can hear me, Chief?
Yep, go ahead, Mark.
Okay, thank you. I'll be brief. And again, we are prioritizing many of our normal spring preparations and ongoing tasks. A lot of our larger projects related to drainage remediation, facility improvements, some paving and line striping is being postponed till later this summer and fall. We're trying to limit our projects to staff that can work mostly independently. So with that, most of our updates and recent undertakings and tasks are on the town's website under updates, behind the COVID banner, I believe, under DPW updates. We are still pursuing a lot of grants related to recycling. We have been made aware most recently of a COVID-19 stimulation grant for infrastructure improvements that we possibly could use for drainage remediation related to Lieutenant Island roads. So we showed an interest in that. We haven't heard back. That was through Cape Cod Commission, I believe. Some good news, most recently at the transfer station, within the next couple weeks, we have found a method that we will begin to accept single stream recycling. Those materials are glass, cardboard, mixed paper, plastic container, tin cans. I'm saying 2 weeks, it might be sooner than that. So if you check in with the town website, we'll have updates on that. So that's a bit of good news there. So really, other than what's our updates show on the website, that's all I have for now, Chief.
Great, thanks, Mark. I appreciate it. And again, that just reminds me, I apologize in the opening comments. All of this information is being kept on the town's website. On the top of the page in the banner, you'll see COVID-19 updates, past videos, department operations, continuity of operation plans are all on there for the town to see, and we do update daily. Thank you, Mark. Community services, we'll open up with Suzanne, and then if Becky has a quick update.
Okay, good morning. Can you hear me?
Yep, go ahead. Good morning.
I'm going to start with the senior center. A couple of weeks ago, Mike Travato asked me to create some scenarios for reopening both the beaches and the senior center. The senior center is a little more concrete. Obviously, my population over there is among the highest risk group. So we're going to start, when the decision is made to start to reopen the town buildings, we will start by limiting people to one-on-one as opposed to group activities. Everybody will need to wear a mask if they're in the building and keep that mask on while they're in the building. I have ordered clear shields that will stand on the desks to create a barrier between staff and the client who needs something, either a consultation or to purchase some soup, whatever that is. Everybody will have to have a mask and, observe the need to have a barrier between us. A big challenge is reestablishing client transportation. Once doctors' offices start to reopen and are having routine patient visits, we will get our need for transportation up. At this point, my initial thoughts are to have only one client at a time be transported and have sanitizing measures before and after each use of a van. I have looked at a vehicle fogger, which is something that the CCRTA has been using on their buses all during the COVID-19 crisis. And I think not only for COA vehicles, but for other town vehicles, it might not be a bad idea to have one available. There's different configurations, different prices. I haven't done my market research, but I definitely want to do that before we begin to have any kind of client transportation. The good news from the senior center is we started our first Friday Meals by Mary Ann delivery on Friday, and with the able help of 9 volunteers, we got over 50 meals delivered out to the general community for people in most need of food and something cooked and delicious that they didn't have to come up with themselves. We are going to expand slowly so that we don't overwhelm Mary Ann or the system, but if anybody knows of someone who is in need of food, not just someone who would like to have a nicely cooked something, but somebody who's in need of food, please call the senior center and we'll put them on our waiting list and try to get them on board as quickly as possible. The second topic is beaches. I'm still waiting for guidance from the governor about beaches and recreational areas. He hasn't come out with that yet. In anticipation of having some form of beach staff out there this summer for safety reasons, I've begun the process of ordering face shields and masks and gloves, hand sanitizer, which actually is available with a wait period right now, which was not true a month ago. I have a case of face shields coming in next week, and I ordered hand sanitizer yesterday, and they said it was a 2 to 3 week wait, which is not bad at all. The general wisdom across the parks, recreation, beaches, lifeguard groups and meetings I've been having is to try to limit the capacity at all locations to between 25 and 40% of capacity. The big question is, how do we do that? And how do we do it without endangering the public safety of the people who are actually on the beach? So that's still up for discussion, and it will be discussed by, I'm hoping, the emergency management team in a separate meeting once the governor has come out with his guidelines for us. And that's about it for today.
Great, thank you, Suzanne. And just a quick reminder, I know this, we have close to 100 participants on the call today. There is several agenda items this evening under COVID-19 update, and the beaches will be part of the discussion. So this meeting, we're already 40 minutes into it, so I just wanted to put that out there that we will have questions after. However, there will be a more lengthy discussion this evening. 6 p.m. is the meeting, and there are several agenda items tonight. So just want to put that out there. And Becky, any quick recreation updates?
Yes, good morning, Chief. Can you hear me?
Yep, good morning.
Okay, good morning. I just wanted to quickly go over, update our reaching out to the community efforts. We have been doing probably 2 or 3 birthday caravans each week with the police and fire department, and so many people are participating that we've decided to bring them through the center of town. So if you hear the sirens and a lot of whooping and hollering through the center of town, it might not be an emergency, it might be the birthday caravan. So it's such a pleasure to see the kids smiling, able to see their friends a little bit, and we're extremely grateful to the police and fire department for making that such a nice, fun, sort of take your mind off everything activity for everyone. So thank you very much, Chief, for facilitating that. We really appreciate it. We're also continuing to do our virtual activities on the Google Meet platform. Quickly to go over them: the family virtual fun dance on Fridays at 6 o'clock, disco night Fridays at 8 o'clock. We're doing a square dance with Ty and Amy, the callers from the summer, live capoeira, soccer, drills and fun. And this week we added a live concert with local musician Sarah Burrell. So the Google Meet platform is really easy to use. You just need a Google account and you click on the links which are on the town website, and you can actually see the other participants. So it's the next best thing to having it live, I guess. Our fitness challenges have been getting more creative. The police dispatchers, last week we had a gymnastics fitness challenge, and this week Selena Austin has introduced kickboxing. So check out those challenges on the website. You have a chance to win a $25 gift certificate. And as far as the department goes, I mean, we're planning for the summer. Like Suzanne said, waiting to hear what that's going to look like in terms of summer rec and swimming lessons. We haven't been given any direction, but we're planning still to have those, programs running. So we're waiting to hear how that's going to look, and we're ready to implement anything we need to do to make those programs happen. So we're looking forward to moving forward as best we can and continuing to reach out to the community. So thank you, Chief.
Great, thanks, Becky, and thank you to Community Services. I know having 3 kids, 17 to 3 years old, this is a tough time for them, and the Zoom parties, the Zoom proms, the birthday caravans, it puts a smile on their face right now, and it's good to see. And it's, for all of us parents, it's been a trying times, to say the least. Fire Chief, good morning, Chief Pauly.
Morning, Mike, Chief Hurley. Just a few things. Just a reminder that May 1st, which is this Friday, coming up real quick, is the last day you can burn brush in the Commonwealth, and brush permits are still available here up until May 1st. But May 1st that's it, folks. We have thoroughly enjoyed participating with the police department and Public Works and the residents of the community with the birthday caravans. It is the one high point in this situation, and I think every little piece of socialization and social distancing, of course, helps maybe relieve a little bit of stress. Just for information, our numbers are up. For the month of March, total fire responses were up 9% over last year at this time, and I anticipate that we'll probably end up somewhere like that, maybe throughout the rest of the year. One thing that I want to say is that, first of all, thanks to Pat Nadel at Outer Cape Health. She provided some really excellent information. Stuff that I'd heard in the last couple of days, she reinforced. As I think most of you know, Chief Hurley, myself, and our health officer are on the phone or on conference calls on a daily basis, getting the most up-to-date information that we can. We're preparing for a summer just like everyone else here, which is going to be full of more unknowns than known. We expect a summer population increase, of course. We actually enjoy that in most years. But on top of that, we're still in a pandemic. So we're dealing with that through the Cape Cod County Fire Chiefs and have plans in place. But I can't stress enough that social distancing is working, and we have concerns with an increase in population as we know we're going to see throughout the summer. So this team is working hard to come up with plans and come up with different scenarios to address that. And I know for a fact that some folks aren't going to like some of the recommendations, as Chief Hurley and I have talked about. But we have to give the best information that we can as an emergency management team to the officials in the community. So please be cautious and be patient with us. We are thinking these things through with multiple scenarios and multiple ways of trying to implement safety and health throughout the community. And again, as I said, every time as I close up, please take care of each other, look out for each other. Make the phone call, do the Zoom call, do the Zoom conference, do the social media, and we'll keep moving forward. Thank you, Chief.
Great, thank you, Chief. I appreciate it. On the police side, just a few quick updates. Staff is still healthy. We're at 100%. We are still out responding safely to calls in the community. Again, we do remind the public of the CDC guidelines, the social distancing in public places, beaches, walking, bike trails, washing of the hands, wearing a face mask in public. We do encourage all of that. And again, I've mentioned it in multiple meetings before, but just another quick reminder that these are all advisories through CDC and government entities. And, it slowed down a bit, but we were seeing some upticks of, people confronting others in the community. And again, the last thing that we want to see is, any criminal charges resulting from this. So, it's always nice to give a gentle reminder. However, if you're in a business or you're somewhere where, the mask is not being worn or people are not adhering to the social guidelines, the recommendation and advice would be to leave, speak with store management or something to that effect. But we're just not looking for any, interaction with community members in a negative manner. We also appreciate all community groups, the Common Table, residents. They've been reaching out to public safety. They've been a shoulder to lean on, dropping off food, just kind of checking in on us too. And we're on the front lines right now. And, myself and the fire chief appreciate everybody who's been reaching out and helping us through this. It is a community effort. I just want to close today. We are also now, every week I try to bring a theme where we're seeing things kind of upticking a bit, and unfortunately scams is one of them. Between testing, stimulus checks, small business loans, there are a lot of programs that are out there, and unfortunately they're subject to scam. So I'm gonna pass on some information to the town website, but I just wanted to, in this call, throw out there, please don't respond to text, emails, or calls from the government. If it sounds too good to be true and they're reaching out, then it probably is too good to be true. So, the irs.gov, please go to that website direct. Do not use links. Do not use emails. Make sure that you are going to the exact website. Ignore online offers for vaccinations or test kits being delivered. My understanding that is not anything approved yet at this point. Hang up on robocalls. Again, watch out for the emails. And again, just be cautious. Even charities, everything right now. And it is very hard for us to investigate these because of the, sometimes they're out of state, out of country. But if you need to file a police report, please feel free to call us in the event that, unfortunately, a scam has happened. But the more we can spread the word on that, and again, if my motto is, if it sounds too good to be true, then I would look at it with the skeptic eye. So Again, as the fire chief said, please watch out for others, neighbors, family. And again, we are here for you 24/7. So if you ever have concerns, questions, or you think that, you know, a friend or family member is in need, please reach out to us. We do have the resources, and we do have mental health professionals, substance abuse professionals that we can reach out to and get that help into the hands of those in the community. So that is your police department update this morning. Now turning it over to town administration, Mr. Hort.
Good morning, Chief.
Morning, Dan.
Just a couple of things. Want everybody to know that every decision we make, really, the public health and safety is our #1 factor. We know full well the impact on the community, including seasonal rentals, including the business community, but public health is our driving factor here. So that's how we make our decisions. The other thing I wanted to bring up is that Amnesty Day, which is normally held around this time of year, we're postponing that till the fall. What we're trying to really do with our transfer station is limit the amount of contact that our staff at the transfer station has to have with the public on a daily basis. So we're not going to eliminate Amnesty Day this year, but we're hoping to postpone it till the fall. And when we have a better date on that, we'll certainly let everybody know. Mike Travato, you have anything you would like to add?
Yes. I do. It looks like my internet connection is a little spotty, so I apologize if I disconnect on you. Yes, thanks, Chief. Appreciate it. Just a few quick items. Our Shellfish constable, Nancy, has posted in a recent newsletter about a new relief fund that's been established by SPAT, the Wellfleet Shellfish Harvester Relief Fund, and that's to assist Wellfleet shellfishermen and their families who are experiencing financial emergencies. An applicant must be a year-round resident of Wellfleet, must hold a Wellfleet commercial shellfish license or a state-issued propagation for Wellfleet license grant. They must make the majority of their income from shellfishing. The next round of the Payroll Protection Program, PPP funding, is now available. If you've already applied, check with your banker. If you're looking to apply, need assistance, Community Development Partnership is available to help you. I wanted to give a quick reminder about the 2020 census. I know it's not directly COVID related, but indirectly it is. Our response rate is kind of low right now. It's important for people to return both their annual street listings and the United States Census, as the 2020 census count will be used to ensure the Wellfleet and the state receive their fair share of federal money and political representation for the next 10 years. Wellfleet's response rate right now is about 16%. Whereas the county is 37% and the state is about 55%. So please respond via email, online, or phone with that. And finally, as we look ahead to the eventual lifting of the stay-at-home restrictions, whenever that's going to occur, here at Town Hall, working on the next steps on how to safely open up the town buildings to ensure the safety of both town staff and the public, while recognizing the need for social distancing. We'll also be looking at ways to improve our online capabilities in order to encourage people to access town services online more and more. I highly encourage that as we transition into this new normal, so that the town can safely and efficiently serve its citizens going forward. That's all I have, Chief. Thank you.
Great, thanks, Mike. Real quickly, I'll just kind of go around my squares here with select board members that are on. I have Kathleen up first. If there's any questions or comments, Kathleen.
Great. Can you hear me?
Yep, go ahead.
First, for Mark Vincent, when can we expect to be able to drop brush off and maybe town residents can get compost from the transfer station? Are you there, Mark?
I'm sorry, can you hear me?
Yeah.
Okay, yeah, so what we're concentrating on right now is essential items at the transfer station. And this has sort of been done piece by piece. Obviously, the most critical one was is accepting refuse or trash. From that point on, we want to do safely accept recyclables. It appears that we right now have a method for doing that we're going to implement in the next week or two. From that point on, we're going to look at brush and compost. Again, this is prioritizing essential items. We didn't take it that composting was one of the essential items on the governor's list, but we're aware that people want to continue that activity. So we are looking at it and trying to come up with a safe plan. So I don't have a time frame on it right now, but it's at the forefront right now.
Thank you, Mark. And getting back to the recycling piece, just quickly, I don't want to take up too much time.
No.
Are you guys going to be prepared for, you know, the amount of recycling that's probably going to hit you very quickly once it opens up?
So we've kept that in mind going forward, and very meticulous and careful about our decision here to open this up. So Mike Sicali, along with the staff up there, and a lot of the other staff down here at the DPW have been involved in all of these projects, but in particular the recycling, he's made a provision for 8 spaces up there for when residents come in. There'll be 8 spaces available for single stream recycle. This is not dual stream as we had before. Single stream recycling includes glass, cardboard, mixed paper, plastic containers, tin cans.
Right.
All in one location where they have to be separated before. There's a little bit higher cost in getting rid of the material, but we can get rid of it, and it's going to be more convenient for the public right now. So we have that in mind, and hopefully it all turns out all right. But I'm asking people to check with the website for the specific date is when we're going to start doing that.
Thank you, Mark. You know how much I care about you guys. You're doing a great job. Thank you. Chief Hurley, my next question is for you. Again, I'm going to restate what I mentioned last week. I think the messaging has to get out in Wellfleet, whether we change the electronic signs on the highway or ask to utilize the marquees at the drive-in and Watt Theater. I'm referring to, you know, a message that says gloves, masks, social distancing. I'm not seeing it. I did a job last week over on Ocean View Drive, and after I finished, I thought I'd take a ride to LeCount. I never even went into the parking lot. I was so horrified at what I saw. I just turned my truck around and left. There were people, the parking lot was full, and there were people just congregating like, you know what, this didn't even exist. And there was an electronic sign at that parking area saying 6-foot social distancing. That's not what I saw. I know there's no way to enforce this, but we have to continue to get this message out there. I know the town of Somerville is now imposing a $300 fine on any resident they see in a public place without a mask. I don't, you know, I'm just a wreck going into Memorial Day or going into the summer and thinking that people are going to still be cavalier to the fact that we are in a pan-endemic crisis in this region. So again, I'd ask that we look at the messaging out on the highway. You know, maybe COVIDneeds.com is not quite what we need to be saying out there. We need to be telling people they need to take more care with regard to keeping their distance and so on. Any thoughts on that, Chief?
Great, I appreciate it. Yes, I mean, we do have currently 3 message boards in town. 1 we own, 2 that are on loaner, so our team can look at messaging and change it up around town. The Watt Theater has stepped up, and they do have on their marquee heading northbound a message about visitors self-quarantining. If there's any other businesses that are in town that have any type of advertising space that they would lend to us as the town, please reach out to any member of our team. But yes, we will continue to work on messaging, improve messaging. You know, I'm afraid to take a sign down somewhere and then the recreation area becomes overrun again. So I know it's frustrating. I know it'll be a topic again tonight at your meeting about, the best direction for the town. And, every day we can enforce the message, we do here. So we will look at that for you.
Chief Early, if I may.
Go ahead, Chief.
Kathleen, I understand what you're saying, and I too feel your frustration. And emotions are high. Everyone is stressed out. My concerns also as the fire chief is if this is what we're experiencing right now,
Right.
what's Memorial Day going to look like? What's July 4th going to look like? And again, I'm not the guy that wants to spoil the party for everyone because, we all look forward to the summer. And I purposely moved here 7 years ago to be on the Cape for the job and for the Cape lifestyle and experience. But we are in unprecedented times. And Dennis Cunningham just posted something which that I did see last night and I neglected to mention. Massachusetts General Hospital has a simulator, and they put that information forward with a simulation of if the social distancing or the business restrictions are ended on May 4th, what might that look like for a second surge in Massachusetts? And if I encourage everyone to go to the Massachusetts General Hospital website and see if you can find that information. Again, I'm not here to spread doom and gloom, but there's some real statistical information there that I think is worth considering. And I know the governor is actually looking at it too, because he's mentioned it in his briefings. So these are things that the emergency management team take very seriously. Summer's busy enough here for public safety officers, police, fire, health, regardless of still in some phase of a pandemic. So I'm stressing again that we're very mindful of this, and the decisions that we are making and the recommendations that we are making clearly are towards what we feel is best for public safety and public health. And this is not going to be a summer like we've seen in Cape Cod in probably generations. But I think we need to be prepared that we're going to have to do things much differently, at least for this year. And I'll chime out on that one.
Well, Chief Pauly, while I've got you there, you were next on my list.
Okay.
And you don't have to downplay yourself as a party guy. We all know you. But I do want to say that I really appreciated your previous comment to the public that are involved in this Zoom meeting this morning by saying these decisions that are being made on a county, state, and regional level. It's just not one group of individuals here picking and choosing what stays open or what stays closed. And at the end of it, at the end of the day, as Dan Hort said, we are only putting forward the health and safety of all our residents and non-residents and staff, staff that are out there working on a daily basis. So thank you, Chief, for those comments earlier in mentioning how these decisions are made on a county, state, and regional level. And thank you to everyone for all the work you're doing. We'll see you tonight. Bye.
Great, thanks, Kathleen. I appreciate it. And just a few quick items. Myself and the fire chief have been in discussions, and part of an equation of what goes into what we're looking at. Both of your public safety departments, police and fire, are going into this summer short-staffed, which is not going to help us at all. The police is sworn for 14 members. I currently have 2 stuck in the academy right now, which has been suspended. And I'm short half my summer staff. And to be honest, some that just don't want to come to work. They don't want to be exposed to the environment.
And they shouldn't have to. Yeah.
It is going to be a tough season for your first responders outside of COVID-19 and a crowd increase. The second thing, and I know it's going to be brought up tonight at the board meeting, but just a reminder, back on the 24th of March, any future applications for use of town property are not being heard right now. And the board did rescind any previously approved town property uses. So, the members of the community can rest assured that for right now, there will be no public events being held on town property. And they can be revisited at another time. We're just trying to take a proactive view. And, some of these groups need a lot of lead time in order to organize themselves. So I know it's going to be discussed again tonight, but just for this venue, we have 100 participants just to hear that again. So Justina, you're up next.
Just briefly, because Kathleen covered a lot, I wanted to thank Chief Hurley and I'm sure the rest of the emergency management team for the conference calls you're on, the information you're gathering. I think we all know it's a tough decision, but we have something precious in the community, which is very low COVID numbers. And I think our decisions also have to go through that lens of how do we preserve the community safety that we're enjoying now. And certainly I know the business community is nervous, but there is a lot of aid from the feds. And I do think business problems are easier to solve than public health problems that land people in the hospital.
Great, thank you, Justina.
Yep.
Helen, I have you up next.
Yes, couple things. Kathleen said this is a county, town, state, even federal issue. What I haven't been hearing, and which is very much an issue and will be more so as it gets warmer, is the decisions about the beaches really should be made always with the National Park Service and the other towns, because whatever we don't have going to our beaches will be going to other places or finding secret access. And that happens quite a lot here. In other words, not a town landing, not an official beach, and then you see a whole lot of cars parked along Ocean View Drive or in the woods somewhere, and people are just going like lemmings to the water. And I get that. So I think that it would be a very good idea to start only, having these decisions being made in conjunction with the park and the other towns. I'm going to be interested. I'm going to see if I can access this today, but maybe somebody else could do it. What other towns have closed their beaches or are going to? Hold on a minute. So that's really for Suzanne, and she may be able to answer it. I have a question for Mike Travato, which is when we originally got notification about the census, we were told that if we didn't answer it digitally, electronically, we would get a printed copy in the mail, and that has never yet come. Do you know anything about this? Because I agree with you, it's very important that we respond to the census for so many reasons. The first of which is, at times, money.
I will follow up. I don't know the answer to that, Helen, but I will follow up with our town clerk and get that answer for you.
Helen, it's not a town program. It's a federal and state program. So the Secretary of State has information on his website, and we can follow up through Jennifer as to why things aren't being mailed, but it's not something that the town mails out. So I'll put the link
to interrupt, which I'm too good at, Courtney. I know that it's not a town thing. This is
I know,
not,
I'm just, yeah.
Yeah, but that we should know that, and it should be a piece of information that the town is disseminating.
I'm putting the link to the census form on the notes to this call, which will be posted online, and you can always call town hall and speak to the town clerk to get more information about the census.
Okay, and just briefly, thank you all. Thank
Great,
you.
thanks, Helen. I do know that Suzanne and Dan have been on multiple conference calls with the Lower Cape, Outer Cape communities and the National Seashore. I think we're just all in a holding pattern right now with some more guidance from the governor. And then I think you'll probably see decisions start falling in line with that afterwards. So I do know that is happening
Yes.
weekly.
Courtney, may I say one more thing to that, please?
I can't stop you.
Yeah, it's true. I'm highlighting what I already said. These decisions have to be made across the board on the Outer Cape. This is a regional situation, and we can't just decide what to do by ourselves. Thank you.
Great, thank you, Helen. Michael, any comments or concerns?
Yeah, I just want to reiterate what Helen said. not operating independently of the other towns. But I think we really need to think about the reality of having short-term rentals. We obviously have to wait for what the governor is going to do for the state of Massachusetts. But people have been cooped up, and the idea of coming to the Cape where we have very low transmission may be really appealing to people. So if people are thinking that we're going to have less people just naturally coming here, I think we're mistaken if we think that that's just going to be the case, because I think the idea of day tripping and short-term rental, or even just not even renting, but just day tripping out here to use our beaches is really concerning. I just want us to all have that in mind, that if we're open and things are proceeding as normal and we don't have restrictions, that we should expect that people will come here. That's it.
Okay, great. Thank you. I'm going to open it up to questions in 1 minute. I just have 2 department heads. If we can just give a quick 1-minute update. Jennifer, you're up first.
Hi, thank you. The first thing is our building too, like Suzanne, we're coming up with plans for what we're going to do, and we're certainly not going to be flinging the doors open to the public anytime soon. It's going to be a very slow process. That is not going to happen in the very near future. We will be phasing it in. I'm in the process of writing something up, what that's going to look like, and I'll be working with the DPW. I'll be working with Hillary because we can't just have people wandering around our building during this time. Concern for people's health, the staff health, the public health has to be the priority in all of this. We can perhaps at some point start with some kind of modified curbside pickup of materials when we learn how safe it is to start handling materials that are returned, and learn how to quarantine those better. So that could be a beginning phase. And that's something that I'm working on right now. We've been doing really well with our digital experience of people using materials, and people have been very successful at that. Again, if you want to, if you need help with that, please go to our homepage and you'll see what we have available, or you can always call 508-514-1483. We've helped a lot of people navigate that. The one thing that is sorely missing when the library is closed is connectivity, and that is a tragedy. With that in mind, I'm in the process of purchasing Verizon hotspots, and I will be making an announcement when those are available. And I hope, I can't purchase enough for the whole town, but I'm hoping to be able to get enough so that enough people can get connectivity that don't have it, that are in an area where Verizon works. So that is going to be happening. And we are also we've canceled our May programs. We're definitely canceling our June programs. I have a feeling we're going to be canceling all of our summer programs. We're working to make as many of our programs virtual as possible. We had one virtual program already, and we have another program going virtually. We have a virtual art program or art exhibit that we just sent out the call to artists. You can see that on our website under virtual programming. We're going to have a great online art exhibit where you can even sell your work if you want, and we're really excited about that. We're about to have online story times and read alouds. Those are going to be going live in the next few days. And like I said, we're working with our summer authors and other events to see how many of those we can do virtually. So we're beefing all of that up. And that I think, and with our virtual seed program, we have sent out 900 packets of seeds.
Great.
So that's what we're up to right now.
Great. I appreciate that update from the library. And real quick, Nancy from Shellfish, and then I will open it up to questions.
Thank you. Thanks, Mike. Let me see. So one of the things that we have been, actually Kathleen kind of brought it up last week, what's going on with our recreational fishery. I'm in preparing my monthly report, I'm trying to see what kind of an increase in permits we've had from last year to this. And one thing that that Johnny and I attended the Barnstable County Shellfish Officers meeting last week, and it seems that other towns are having some social distancing nightmares in the recreational fishery with people not keeping 6 feet apart. And so it has not been a problem yet here, although we see increased recreational shellfishing activity. We are going to keep our eyes on it, and we might have to explore mitigation measures should that start to occur here as we get into the summer months. Right now, what we're doing is we are prioritizing our recreational patrol because on sunny days, it's very busy over there. And as Kathleen brought up last week, we have been seeing people without permits on the flats. Even on Saturday, Johnny had to do a confiscation. So unpermitted people, we can't have that happen. It is a natural resource and you need to have a permit to get out there. We're doing our best. Jeannie McLaughlin and Courtney Butler in Town Hall are both helping with sales via mail, and that's how we have to do it for now. But sometimes people forget to put their checks in. Sometimes people forget to put in a self-addressed stamped envelope. So it does take a little bit longer, which means people have to prepare ahead. But we're prioritizing recreational patrols because we need to. And I am looking forward to Drew getting back here because we're going to need an extra body to help with this, and we certainly will need extra help this summer.
Great, thanks, Nancy, and again, thank you to all your staff, and stay safe out there on the flats. And if if the residents and the shellfish community can work with Nancy, as like us being out on the front line, she's trying to keep her staff safe also. Thanks, Nancy.
Thank you.
We're going to open it up to questions. I see a few hands raised. If either you have a question or a comment, and before we open it up, Courtney, I did have a private question. And Hillary, I'm not sure if you're still on the line, if you could address this on pets. The CDC has recommended they be treated like family members. We're having dogs that are jumping on people while out for walks. I don't know if you can comment on that.
So I have heard that about dogs as well, and it is important that folks keep their dogs leashed and off of other people because they can transmit the virus when they jump up on people if their pet owner has it as well. So keep your dogs on leashes, please.
Okay, great, thank you. And we also have Animal Control Officer Desmond Keogh, and if there's any concerns or issues, please notify our department and we will get the message to him. Suzanne Thomas, I see your hand raised.
Yeah, a couple of things, Mike. The census, number one, as COA directors, we were all informed in February that no hard copies would be issued to the towns of Eastham, Wellfleet, Truro, and Provincetown, and that no one would be going door to door because of our poor response rate 10 years ago. So the only way that people in those towns can file a census is to go on the website or to use the phone number that the census people provide on their website. So if you're waiting for it in the mail, it's not going to come.
Great, thank you, Suzanne. Justina, I see.
Hi, just quickly to echo what Mike said about short-term rentals. I'm probably saying something that's on everybody's mind, but at my last estimation, we have 700 of them, and it means we get waves of new renters every week. I know from running short-term rentals myself, the majority of my renters coming within driving distance. So that means we'd have weekly waves of new renters, including Boston and New York, which have been national hotspots. So that's one comment about a challenge we face. And secondly, I know that renters who have booked are having trouble getting their deposits back. Everyone's waiting for the governor's ruling, and I do believe people can book now. So I think it's a very difficult question to confront, but I just wanted to express the things that keep my mind working on it, and the short-term rentals being a unique challenge of our community.
Great, I appreciate it. Thanks, Justina. Courtney, I don't have all the boxes on my screen, but is there anybody else that may have a question? You either virtually raise your hand or in the chat box, you can raise your hand.
I'm not seeing any questions in the chat that haven't already been answered. I guess one is, do we know how much revenue we got from last year's Airbnb tax? Is there a short-term rental plan? I think this has been addressed. This is ongoing right now, everybody, and we're doing the best we can to address this. And until guidance comes from the state, we can't do a whole lot, but these are all not things that the team is not considering. We're taking all of these into our minds every single day, every hour, and trying to figure out a plan that is cohesive. So please just stay tuned to the website. Feel free to tune in tonight to the Selectmen's meeting at 6 o'clock, and more information will be provided. But I'm not really seeing any other things in the chat here, Chief Hurley.
Great, thank you, Courtney. Again, this evening, tonight, 6 p.m., there will be a select board meeting with the same style Zoom meeting. And there are several COVID-19 topics on there, including beaches, town property use, and the July 4th parade. So that is at 6 p.m. tonight. Next Tuesday, we will hold our 10 a.m. meeting, and I'm hoping by then we will have further guidance from the governor and some more answers for this summer. And we appreciate everybody's patience. We had over 100 participants today. The community engagement's been awesome, and the questions. And again, please reach out to individual members on our team, police, fire, community services, DPW, health agent, and administration. Everybody has been working long hours, long days, conference calls, Zoom meetings. And again, we're just looking out for the best interest of Wellfleet. Chief, any final comments?
No, you just summed it up completely. Thank you.
Okay, great. Everybody, please stay healthy, stay masked, and keep your social distance. Stay safe. See you next week. Bye-bye.